Dr. Quinn, tell us, what is nightmare disorder?
Well, as you said, nightmare disorder is a real diagnosis, and it affects about 3 to 8% of Americans. And it's a condition where a person has nightmares. Now, there are different levels. You can have mild, moderate, or severe. Mild is maybe less than one a week. But if you have one or two a week, then you're moderate. And if you have it every night, that's severe. Now, these nightmares, they have to interfere with your daily activities, meaning that if you have a nightmare every now and then, but you wake up and you're fine, no problems, you don't have nightmare disorder. But if they interfere with your daily activities, maybe it's harder for you to perform your job, or maybe you're a student, you're doing poorly in school, then you have the disorder, and it's something that you want to talk about with your medical provider.
Yeah, absolutely. So what are some of the more common causes of this disorder then?
Well, the most common cause is post-traumatic stress disorder. And that's someone that's been through a very traumatic event. Maybe they got robbed at gunpoint or knife point. Maybe, they were in a hurricane or a fire. It's more prevalent in that population to have this nightmare disorder, but also other psychiatric disorders such as anxiety. They can have nightmare disorder. And then there's some medications to include beta blockers and serotonin reuptake inhibitors. Also, some other medical conditions such as asthma, bronchitis, or even migraine headaches. All of these can contribute to someone having this nightmare disorder. But the take home is, if you're having this disorder, meaning you're having nightmares and it's affecting your daily life, talk with your medical provider, because treatment can be very effective.
So on that note, what are some effective treatments? I know you already touched on a few.
Well, as far as treatment, when you go visit your medical provider, you share your history and you're diagnosed with nightmare disorder, meaning you're having these nightmares and it's adversely affecting your daily life, your job, your marriage, your school if you're a student, then the first thing we're going to do as medical providers is rule out any causes that might be untreated. Maybe you have post-traumatic stress disorder and it's never been addressed, it's never been treated. Typically, if we treat the underlying cause, if you have a cause identified, then the nightmares will get better. But treating specifically the nightmare disorder, the first level of treatment is psychotherapy. It's a type of psychotherapy called cognitive psychotherapy, where you talk about your headaches and your nightmares, and you write it down and you try to come up with a better ending. And this is very effective for a lot. And then some people need medications, such as benzodiazepines, that help to decrease your anxiety. And lastly, how do you deal with the nightmares as part of the treatment? When you wake up from a nightmare, it's a good idea to identify specific objects in the room, like there's my lamp, there's my closet, and it orients you that you're not in a nightmare. It's not real. And you want to say positive things like, I'm okay. And this type of positive reinforcement helps you overcome nightmare disorder.
Maybe you write down your dreams too sometimes.